Who's first?
All right, welcome back. You may think your heart is healthy, but did you know 1 in 3 deaths are caused by heart disease and stroke? And this morning we're going to continue Heart Health Month, and we're talking to Dr. Stephen May. He's a cardiologist for the Arrhythmia Associates of South Texas, which is a part of the Baptist Health System. Good morning.
Good morning, Monica. Thank you so much for having me on.
Yes, you know what? This is one of those things I think it surprises people, because a lot of times we talked about it the other day that it kills more women than any other disease. And I think we all think breast cancer because we hear a lot about it, but heart disease actually is the #1 cause.
Certainly. Any death is tragic, but statistically, heart disease kills more people, including women, many more than breast cancer, COPD,
Wow.
trauma, all those things together.
Okay, well, let's talk about some of these devices you brought in, because a lot of times people get nervous. They don't want to go to the doctor. They feel something, but they're like, okay, maybe I'll just wait. But do you suggest somebody wait if they feel anything related to their heart?
No, these things can be serious. Even sometimes asymptomatic things, when people don't feel anything at all, can be suffering from problems of heart disease. And so take your heart seriously, and if you're having any symptoms at all, you should see a physician. As a cardiac electrophysiologist, my specialty is heart rhythm disorders. So frequently I see patients that are dealing with palpitations, shortness of breath, mild chest discomfort, and these can be signs of your heart going out of rhythm. Fortunately, we now have ways to treat patients that have heart rhythm disorders with a procedure called catheter ablation.
Okay, and this is what you have here.
Exactly. I brought a couple examples. The standard catheters that most people use for catheter ablations are fairly rigid. We put them up into a patient's heart, and we're able to use them to map the electrical systems in the heart, find trouble spots, and then correct them. But because the standard manual catheters are controlled by hand, they have to have some degree of rigidity.
Okay.
I'm excited to say that the Baptist healthcare system is the first and only hospital system in San Antonio to provide a new and improved way of performing catheter ablation. It's called the Stereotaxis Robotic Magnetic Catheter Ablation System.
Say that 5 times in a row.
So these are special catheters that you can see are very floppy, almost like spaghetti noodles, but they have magnets embedded in them. Wow. And what that allows us to do is, using special magnets that are obviously much larger than this, and remote controls, 3D mapping systems, we get these catheters into the heart and then use our magnet control system to move these catheters in 360 degrees to any place in the heart with extreme precision and control. And what this provides for our patients is an added level of safety, and it allows us to do even the most complex EP procedures quickly, safely, with more precision and control, with less radiation, and with better outcomes for our patients.
That's fantastic. Well, before we leave this morning, we want to talk about, during the month of February, Baptist Health System is actually launching a public awareness campaign called the 28 Days of Heart Health, and you can go to bhshearts.com to receive a daily heart healthy tip. But also, they're giving away these pedometers as well.
Correct. And again, just to emphasize to everyone, even if you think your heart is healthy, most of us are at risk of heart disease, so you owe it to yourself to go online, take a minute, sign up for these tips, and take steps to improve your heart health. And these pedometers are just a little added benefit to help motivate you, and are a good way to track your baseline level of activity and get you moving in the right direction.
That's right. So go to BHS, as we have it up there, hearts.com. The first 1,000 people are going to receive these pedometers, and then you can sign up and get your tip every day. And a lot of times you're saving not only your own life, but a family member or a friend's life as well. Thank you for being here so much.
Thank you for having me.
How incredible how far we've advanced.
It's amazing.
And I think we're going to go even further, huh?
Absolutely.
All right, we'll be back after a break right here on Fox News First. Please stay with us.